Everybody in attendance, and it's 4:30. I'm going to go ahead and hit this record button if you're ready.
I'm ready.
Okay, hang on one second. Health Committee, July 6th, 2020. Okay.
Thank you. Scott, you got us going?
Yes.
Okay, thank you. I'd like to call the July 6th, 2020 Health Committee meeting to order. We have all members present, and so the next item is approval of minutes from May 19th and June 1st. Do I have a motion? Motion by Robustelli, second by Chung. Are there any additions or corrections? Hearing none, all in favor, please raise your hand. Any opposed? Okay, minutes are approved. We have members of the public. Ms. Morlock.
I have 3 letters that I received in the mailbox for admin. The first one is from an Ellie, and it's Jihan. Hello, this is a public comment intended for the meeting being held on 7/6. I have been following the case of former McLean County Communications Specialist Dion McNeil, as well as that of Carrie Jones. Racism is a public health issue, and police brutality exists in our community. So it's very disheartening and confusing that after expressing these truths, Dion was fired and his supporter Carrie was placed on leave. Black people are disproportionately affected by COVID-19, and a Black man in our community was fired during this global pandemic for speaking up about racism. We demand transparency around this issue. Stop silencing Black people. Ellie J. The second letter I received is from a Dr. Sarah Elizabeth Kienzler, Kienzler, to whom it may concern. I was deeply troubled to hear that Dion McNeil was fired from the McLean County Health Department after expressing concerns about treatment he received while enacting his duties, and that Carrie Jones was placed on administrative leave, purportedly for expressing support of his concerns. While I hope the situation is more complicated than this, it does appear from the outside to be a simple matter of individuals high in an organization punishing someone for blowing the whistle on behavior that did not place the organization in the best light. This is deeply disturbing. Everything I have read on this topic suggests that this is an extreme and deeply harmful overreaction to an individual attempting to address for the benefit of this this organization to clearly recognize public health crises, COVID-19 and systematic racism. Due to a possible miscommunication and the organization's apparently inappropriate reaction, I fear that the organization will be deeply tarnished with accusations of racism and punishing a whistleblower. I want to encourage that this organization make the best decisions going forward. Whatever poor decisions and mistakes were made by any of the parties involved, a transparent, honest process is needed for the sake of the community. Were people placed on administrative leave or fired inappropriately, that needs to be addressed. If these steps were appropriate, which under the circumstances seems hard to believe, that needs to be clearly communicated to the public at large. And again, a transparent process is needed. Hate has no place in the Bloomington Normal community and McLean County. We need to know that systematic racism is not making its presence felt within our public health organizations, and that some accusations of racism appear, and that should accusations of racism appear, that it be handled fairly. Whistleblowers should have protection, though I understand the situation could be more complicated. Also, we clearly need people of color in upper level positions in all county organizations. Wishing love and safety to my former home, Dr. Sarah Elizabeth Kienzler. And the last one that I received is actually just a couple of questions from an Erica Marie ACEEEDO. What is the health department's stance on police brutality? Why was the statement made by Dion unacceptable, and why did it result in his termination, as well as Carrie being placed on administrative leave? Thank you.
Thank you. Moving on to departmental matters. First up is Jessica McKnight, Health Department Administrator. Jessica?
Good evening. So you have my report in front of you, and I'll entertain any questions.
This is George. Chairman, may I have the floor a second?
Yes, you may, George.
Yeah, what I want to know is if the courts would rule that the governor has no authority on keeping the businesses closed, are you ready to do the testing and the stuff for the virus? If they opened up all the businesses, if the courts would strip the governor of that power?
So in phase 4, most businesses are open to a degree. So we have, though, been working to expand testing in the community. We've got testing out at the fairgrounds still, and they're seeing a good number daily. And we're working with a lab to get contracted to be able to start expanding that testing with Chestnut, the FQHC, hopefully by the end of this month is our plan.
So right at the current, you wouldn't be ready if they opened up all the businesses. You'd have to wait till the end of the month before you'd be ready.
Testing is available, so there are some private providers that do offer testing. Also, again, at the fairgrounds, it's available. We would just be expanding. So in Chestnut, the federally qualified health center, they do testing as well. We would just be helping to expand that. And so that is what I would say is not ready until the end of this month, but testing is available in our community.
Okay, thank you.
Member Robustelli?
Thanks, Mrs. Chairman. Ms. McKnight, I wanted to talk a little bit about the testing center out on the west side of town. I think it's pretty well known that there have been some issues in terms of response times from the time in which people go and get tested to when they receive their results. And that's extremely concerning to me for a variety of reasons, because that time frame is so vital for the contact tracing program. So I've heard from constituents. I know that what I've heard in the most extreme cases, in some cases, constituents have made 4 or 5 phone calls to both the testing provider and to the EMA. I've heard nothing but positive things about the EMA's response. I think they've done a really good job of trying to get these results back to those that have been tested. But I can say, personally, I was tested last Sunday at the center. I've made 2 phone calls to follow up, and I still have not received my results. And so I made a phone call last Thursday, and I made one today. And again, the EMA did a very good job. This is extremely concerning to me, because if that testing center is seeing, it is providing increased numbers of tests, and we're not getting those results back, I'm worried that the positive cases aren't known. And so if you just look at my case, it's been over 8 days. It was a holiday weekend. Of course, I'm practicing social distancing, wearing masks, washing my hands, doing everything I can to do all things the right way. But it seems to me people should be able to get their results much quicker than 8, 9 days and without making this many phone calls, especially as Member Wendt talked about, things are opening up more and people are getting out more and they're shopping and they're doing things. And so our testing site and the time frame to getting those results back is absolutely critical to our success in controlling the spread of the virus. So I wonder if you can share a little about what you're hearing and what steps we could take to get the testing provider to be more responsive and quicker for those that are being tested.
So yeah, we've heard similar concerns from the public about the timeframes between testing and results, and yes, that timeframe is crucial to get those results back quickly. And so I've definitely made lots of contact to the lab that is in charge of the testing site. And last I was told was that there was an issue, but it had been fixed. So hearing your own story about results not receiving them, that just shows me that maybe it has not been fixed. So I will continue to try to work with the lab that is running this site, but the public can also call the McLean County Health Department, and we can try to work and get results for them as well. But, you know, obviously this is concerning for us because, again, for us to do contact tracing and control this, we do need results quickly. So I will definitely reach out to the lab again.
Do we have a contract with the lab? Is that the contract through the health department, or is that a contract from somebody else?
Right, it's the lab with the Illinois Department of Public Health. So
It's the Illinois Department of Health.
It's in our county, yeah.
Okay, great. So I just think we really need to, this is a metric that is really going to determine our success as a community, and that is the response time for testing. And so if we can get some statistics from them that shows more hard and fast, what is the average response time? And if there are anybody who doesn't get a result after a certain day, that they report it to you, so that at the very least you know who those people are on that list after it's been flagged. I think that's really important because, like I said, for me, 8 days have gone by and I have no idea how my test will come out. I suspect it will come out negative, but it doesn't give me a lot of confidence in the infrastructure we're trying to build here when that happens. And on top of that, I'm hearing from constituents in District 8 who are saying they're having the same experience. So I just hope that, I appreciate you saying that you've also heard that this is an issue and that you'll do everything you can to try to get them to be more responsive. And so for the public who's listening right now, if they have not gotten their results, they should call the EMA office, is that right? Or the health department, and you'll try to follow up and get those results? Is that the process they should follow?
Contact the health department, and especially for us to be able to know that the issue is still here. But, you know, we can potentially look into seeing if the results, you know, are on the state system.
The other, Ms. Chairman, if I could, I just have one more question about the report that she gave. May I ask a quick question about that, or do you want other people to chime in on this topic and then I can move on if it's up to you?
Is it about the COVID stuff or is it something
Yeah,
else?
it's about the particular objectives that she had outlined in the report. And specifically there's one where setting strategies. The objective started in June 1st, and the strategies were to target a multifaceted communication plan at high-risk populations. We're seeing that there's a disproportionate number of positives in the test results coming from minority populations. And so I just wondered if you can give a report out on, since we've been over a month at this with this particular objective, how we are doing in terms of building those partnerships and engaging in a multifaceted communication effort to try to reach this vulnerable population.
Right now, we're kind of rebuilding the idea of what the communication plan will be with our public information team. And so one thing that we have done is some information about low risk is not no risk, and specifically reaching out to our partners at NAACP to help us really get that information out to that population that we were trying to reach. So that's just so far where we are at, but it's definitely something that is going to be an ongoing process. And, you know, we are kind of back to planning. So we'll see more planning over the next couple weeks and months, but I hope to have a plan where we have more objectives and strategies outlined with how we're going to do this and what we're specifically going to do.
Okay, I guess my only comment is I think given the time that's passed and given the results that we're seeing in terms of these vulnerable populations having a disproportionate number of positives, that I hope we can go from planning to execution quickly, because we need to reach these vulnerable populations in order to prevent the spread of this virus. And if we take weeks or months to do planning, that I think will lag in terms of execution. And I think we need to execute on this with partners and different groups. And so I just hope we can move a little quicker than the planning at this stage.
Member Metzger?
On this same document, I would like to see outcomes, status and outcomes, which is similar to what Member Robustelli mentioned, kind of a status of where we are with those. For instance, I believe it's the third activity down on page 4. That should be complete, and there is no outcome. And so I'm curious as to the outcome of and the status of these as they move forward. And on the activity of page 5, related to translation services and interpreters, I'm assuming that we are looking to organizations to hire to do this work. We're not looking in locally, or are we looking locally? Because if we are, I mean, I think there are people who do that in our community, and it's probably better to hire local if we can. So just a thought on that.
Sure, yeah. So for interpreter and translation services, we have a couple companies that we do use here on a regular basis, but we're also looking for, bilingual contact tracers if we can find them. But yeah, we have a couple companies that we do use already for our other services here at the health department.
Have you reached out to some of, like, St. Mary's Church has a huge population of Hispanic and Spanish-speaking people, and they have interpreters all the time helping at the courthouse. In addition, Western Avenue Community Center has interpreters, and so you may be able to get some of those people, because I know they're always kind of available. So if you need assistance, if you want to give me a call, I can put you in contact with some people.
Okay, thank you.
And status on the training personnel to conduct contact tracing. Can you give us some status on that? Because it should be complete.
Mm-hmm. So internally, we have, I believe 3 or 4 that we have trained up to do contact tracing and to help out with that. And then as far as the temporary part-time that we are hiring, the position closed yesterday. So we're going to start doing our interviewing and the hiring process.
So do you need to expand or adjust that expected outcome date?
In terms of how many?
No, you said you would have it done by June 30th.
Internal or the, I'm sorry, what page?
Page 4,
Page
the third activity down. Page 4 of ours, so it's page 1 of your document. I'm sorry.
I believe what she said was that she's got 3 more trained, and that was the internal people that they were going to train, and that she's got it done.
Yes, so we have 3 internal staff that are trained, and then we're working on the hiring process, which probably will be done, hopefully in the next month or so.
So is that one, does that need to be expanded? So, or is it complete? Again, because there is no status on these, it's impossible for me to understand where we're at on these.
And I can definitely update this work plan. It is a work in progress. We have gotten the feedback back on the initial application, and since the funding source did change, some of the allowable costs are changing. Therefore, some of these activities will be changing slightly. But I can definitely update this and keep you updated each month on where we are on the status of each of these objectives and activities.
Perfect. Thank you so much. This is good work. I like to see the detail. It's perfect on that. We just need a little tweaking on it.
Update.
This is the actual application that was sent in and what was required for the state funding. Is that correct?
That's correct, yes.
Member Went, did you have something you wanted to say?
Yeah, I was just gonna say, I don't know if they ever need anybody that does Russian or Polish or Ukraine. I know somebody that can do all of that interpretation. So if they need somebody for those 3 languages, this person would be available.
Okay, thank you.
Anybody else? I have a question. It's kind of going back to what Member Robustelli was questioning about the timing on that. So today you had sent out the update and said that there were 7 new cases. So when you get those numbers, do you know when those people were tested so that you can actually see the time that it's taking from the time they're being tested to the time you actually get results?
Yes, we can.
Okay, because that was kind of like going back to what Carlos said about seeing how long it's taking. If these are ones from a week or a week and a half ago, I guess that's kind of more evidence of what he was talking about. Member Martin?
Maybe we could have Jessica explain.
Not to belabor the point, I know a first responder that got tested last Tuesday. No results yet. What is the time frame?
I'm sorry, I think my phone cut out.
He had mentioned that he had a first responder that got
What is
tested last
right?
Tuesday.
What's the time frame turnaround? It is purported to be 4 to 7 days is
Yes.
what the lab says the turnaround should be.
Jessica, I think Member Martin said that he had a first responder who got tested last Tuesday and still hadn't received his results as well. And so he didn't want to belabor the point, but I think Susan asked a really good question, which is, you know, a lot of people, when they get the report, there's 7 new cases today, that's really a lag measurement, right? That's from sometime over the last 3 to 7 days at best. Is that accurate? I mean, these aren't, someone tests positive, it doesn't immediately show up on your report. It could be last Sunday, somebody tested positive and it's showing up on your report.
Correct, yes. So the electronic lab reporting, whenever it comes over to us, it's, you know, right now, not an instantaneous. It could be 3-5 days since that specimen was collected. And, you know, that's why everyone is encouraged, if they do get tested, that until they get their results, they should be treating themselves as if they do have COVID, because, you know, it could be a couple days, even in the best circumstances.
Member Went?
Yeah. Now I had the test done, I think, at the hospital, and then I had to have it for a procedure, and I think they got it back within a day or 2. It seemed to me that I just went in there a couple of days before I had the procedure. So maybe I ought to talk to the hospital, see who they're using, if they're that quick. And that was USF.
Member Gordon?
Thank you, Madam Chairman. I've had a concern that has come to my mind in the last few days. It's not directly related to Ms. McKnight's report, so I want to be sure that I'm in order raising the question. But it is, in a broad sense, connected to a lot of the things we've talked about here this afternoon. Ms. McKnight, has the health department been in touch? I'm sure the answer is yes on this, but has the health department been in touch with Illinois State in connection with the following question? I've wondered, and I know you have too, and I'm sure ISU has, what is the effect going to be? What are the impacts going to be on the Twin Cities if, and that's a big if, 21,000 ISU students return to campus. Because some of the concerns about contact tracing, some of the concerns about test results being getting back to the people who have been tested, all of those are part of the picture. But the concerns that I think we've heard this afternoon would be greatly multiplied. And concerns about the timelines on contact tracing would be greatly multiplied with impacts of 21,000 students returning and another, 2,200 at Illinois Wesleyan and some others at Heartland who may not be here now. I'm quite certain, I don't have any factual information, but I am quite certain that those kinds of questions have been in your mind and on the minds of the health department and the folks at the institutions of higher learning. But in a very broad way, playing off or building off of the questions that have been raised here this afternoon on much more specific and very important things, can you at least give us some idea of what kinds of conversations you've been involved with?
So not myself personally, but someone on our staff has been involved in ISU's conversations as they plan. So on the work groups that they have that are planning for what fall will look like. So we're definitely involved in those conversations. And, we have seen a lot of, an increase in the 20-year-olds in our case numbers recently. So it's definitely a concern of ours and something we're focusing on of how do we reach people and how do we, make this seem as important as it is.
Well, I appreciate your mentioning the age demographic because all of us who have been following it are well aware that that's where the increases seem to be nationally more than in some other older age demographics. And of course, with student populations, that's the traditional student populations. That's who we're talking about. Thank you.
I'd actually kind of like to segue on that one to not just higher ed, but K through 12 and daycares, because that is apparently where other states and areas are seeing a dramatic increase in case counts. And have you been involved with any of the daycares or the K through 12 schools in either Bloomington Normal or the rest of the county?
Yes, definitely in conversations with the different school districts, again, as they're planning and looking at the IDPH guidelines and even the IHSA guidelines for bringing their students back for practices and getting ready for fall sports. So we're definitely involved in all of those conversations and just trying to be as helpful as we can and be, that guidance for our community.
Okay, and my other question is back to Chestnut and their FQHC, and you're working with them on that. Can you explain, currently I believe Chestnut's only testing their current patients that are patients of the FQHC. Is this going to be an addition to that so that it can be anybody can go there? I just want to make sure that we have other opportunities and locations to make sure that the public will know that when that opens, it's also open to the public.
Yeah, our portion of this expansion of the testing would be mobile testing. So taking actually us doing the testing. So right now it's two separate things. Chestnut is doing testing, and then we would just be partnering with them and their mobile unit to do testing as the health department. So it would be open to the public, and we would just be taking that out to different areas, the rural areas to start with. So that's our plan, to expand on what Chestnut is doing and use that partnership. Really, they have the mobile unit. We have people we have staff that can help us with the testing.
And who would be paying for those tests?
Right now, whenever we would be collecting the specimens, I've written it into the grant, the contact tracing grant through IDPH. So the health department would be paying for that agreement with the lab to test the specimens.
Thank you. Any other questions? Member Robusto.
Jessica, one of the things, in the research that I've been doing is the CDC really has left the decisions about precautions and guidance to the local health departments and the state health departments. And so in particular, I'm thinking we have 3 flights a day that come in to Bloomington Normal from well-known areas of the country where there is surging cases. And so I wonder, so several from Dallas and then from Atlanta. So I wonder if the health department and the Board of Health has talked about when and if you will issue some guidance to those that are traveling from those areas. And if you are considering, for example, a stay-at-home 14-day recommendation for people that travel from those areas into our community, or some guidance around testing. If you travel from those areas, would you, getting tested and staying at home until you get your results? Just sort of walk us through what you're thinking in terms of the local approach that we're taking to protecting from the spread of COVID from those that are traveling to known places where it's surging.
Yeah, I've definitely been right in line with my message to the media the last, almost a week now, because we are seeing so much of our new cases that are related to out-of-state travel, and especially to those areas that are having increases right now, those hotspots. So, that's been my message to the media, but we're definitely open to trying to explore maybe some additional conversations with our airport to get messaging out, really, again, to encourage people to look before they travel at where are you going and what's going on there. And then, when you get back to get tested within so many days. But, travel, again, out-of-state travel is something that we are definitely seeing a lot of cases associated with. And so, we've got a board meeting this week and can definitely talk more about what we could potentially do to get that information out there. But, we've started again every day. I'm telling the media about out-of-state travel. We're seeing it, and encouraging everybody who's traveling to take those measures to try to protect themselves while they're traveling.
I think the only bit of feedback I would give is that there's so much vague kind of recommendations out there. It's very difficult. So I would just say, whatever is the best public health practice, I hope that you will lean in as heavy as you can and make that guidance. So if we need people who travel to get tested and to quarantine in place, then let's say that. Let's just say, if you travel outside to these states over this period of time, get quarantine, stay at home until you get tested and you're positive. People need clear direction. I believe people want to do the right thing. Right now, it's very difficult to know what the right thing is to do, because if you go to the CDC's website, it's extremely vague, and they point to the state and local websites. And when you go to the state and local websites, they're not giving similar direction. So I think we should, I'm glad to hear that you're going to have that conversation. Whatever guidance you give, I hope you'll make it very clear what people should do based on the best public health practices, so that we can give our local economy and the health of our residents the best chance at this, because there is no doubt cases are going to come in. And if people aren't told, if you travel to those places, you should be staying at home for at least 14 days or until you've been tested and you are negative, then right now that isn't out there. That is not something that I think is really well known. And there is no specific direction that people have other than sort of the conversations you're having with the media. So I would say, if that is what we should do, I hope we'll have it on the website and we can give that guidance locally so people know that's what we recommend that you do.
Thank you. Any more questions for Ms. McKnight? Okay, thank you very much. Next is Miss Taylor, the nursing home, and Miss Evers, our new nursing home administrator. I think that's right.
Good evening, everyone, and thank you for letting us speak for a few minutes. I'd like to introduce Terry Edens to you, so I'm going to step back so you can actually see her. This is our new nursing home administrator, Terry Edens. She started with us on June 22nd, on Monday, and we have been working with her to get her up to speed on all things McLean County Nursing Home, including her report to the Health Committee, which Camille and I assisted with this month. And Terry is excited about taking on next month.
And Camille is excited. I'm joking.
So we do have some action items to bring to your attention with that. In addition to our regular report, the first one on page 8 is with Medline Industries, and I will entertain any questions you might have about that.
I'll have a motion to request approval and agreement between the County McLean and Medline Industries LLC for medical supplies at the McLean County Nursing Home. Motion by Chung, second by Robustelli. Questions, comments? Hearing none. I guess you're okay on this one. All those in favor? Raise your hand. Any opposed? Okay, Member Martin is opposed. Okay. Is that correct?
Or is he just like?
Maybe a thumbs up or a thumbs down. Try that, Randy. I know you look frozen.
Thumbs up. Okay. All right. Thank you. The next item is a request approval of a master staffing agreement between the County of McLean and Grape Tree Medical Staffing LLC, and that's on page 12 through 24 of your packet. And I'm going to take these all separately, even though they're kind of the same topic, because they're new and they're different, and so we have that one. First motion by Chung, second by Gordon. Would you like to discuss this one?
So all three of these are agreements with nursing staffing. So this would be for RNs, LPNs, and CNAs that are needed in the nursing home. Our overall goal is to eliminate agency staffing, but from a review that we've conducted in the last month regarding our usage, we discovered that there are times when there are hard to staff weekend shifts or overnight shifts where we have been paying premium rates, where if we expanded our footprint with these different contracts with agencies, we would have a ability to make the most cost-effective choice for the department. And so that is the request, with the ultimate goal of not having to use any of these contracts because we are fully staffed internally.
Any questions? Member Metzger.
And how did you vet these organizations?
These were organizations that were vetted from our Director of Nursing, Diane Cochran, who is familiar with staffing agencies in the area from her experience as a nurse.
Are all three of these new to us and a different agency than we've used in the past?
Yes, these are new, all three new services.
Any other questions? Member Chung.
Thank you, Madam Chair. I guess my question about this, I couldn't seem to figure out what is the difference between these three companies. I guess, are they staffing different kinds of nursing? I was reading them and I couldn't seem to really figure that out. So if I could have that answer, that'd be great. Thank you.
So the contracts are fairly similar and the agencies are fairly similar. The difference is the people that they have been able to recruit for their team. So this just provides us with greater variety.
So what you're saying is each one of these organizations specializes in maybe a unique piece. Say one does LPNs, the other one works with RNs. Is that what I'm hearing? The other one might be nurse assistants.
No, they all three would contract with all three of those levels of nursing. But they work as an agency to recruit people. So if Kathy Taylor was an RN, I would have a contract with Grapetree. And if Terry Edens was an RN or an LPN, she would contract with a different agency. And so this would just provide us a greater base of nurses to choose from.
So it's not that any of these has a specialty. They do the same work.
That was my understanding, yes.
Any other questions? Okay, hearing none. All those in favor, raise your hand, please. Any opposed? Okay, motion passes. The next one is request approval of a staffing agreement with nursing PRN. And that was one of the ones that you received today in email. Can I have a motion? Motion by Robustelli, second by Chung. Any discussion on this one? Member Gordon.
Thank you, Madam Chairman. There was one phrase on the first page of the PRN Health Services Master Staffing Agreement, and I'm reading that verbatim. There's one phrase there that I did not see in the other two agreements, and it may simply be that it's understood elsewhere, but on the first page of this Master Staffing Agreement, under Section 2, Scope of Service, the first sentence reads, "The provider shall provide its personnel to the purchaser on an as available basis." And since I didn't see that elsewhere, I'm wondering how much significance that has. And it does raise a small concern, because if they tell the nursing home, well, you need some help right now and on such and such a date, and we don't have anybody available, what situation does that leave us in? That's the concern. And the fact that the language doesn't seem to be present, that I found anyway, in either of the other two agreements.
So Member Gordon, I think you hit at the crux of the matter. Is we've had, it is implied in the other staffing agencies as well as the ones that we currently enjoy a contract with. And that is part of the problem, is that if they do not have availability, then we are stuck. So if we increase our contracting ability with more agencies, then we have more nurses to call upon to help us in those hard times, like an overnight shift on the 4th of July, for instance. And so one thing that we have discovered with these nursing agencies is if they have a nurse available, but that nurse has already served in her capacity for a 40-hour time frame within a week, then they will sometimes be able to pick up extra shifts on a weekend or beyond the 40 hours, but then we are paying a premium rate of double time, and we don't want to do that. And so if we have more contracts to choose from, then we can get away from that.
Okay, thank you. So that the greater the number, obviously within limits, but the greater the number of services with which the nursing home might contract, the less likely it is that let me put it positively, the more likely it is that we won't be out of luck. Is that what you're saying?
Correct.
Yeah. Did I also say, Madam Chairman, if I can add in one other thing just to follow up on something that Ms. Taylor said. Did I understand you to say that one of the purposes of these agreements is to eventually make them unnecessary?
Yes.
Can you go back over that one again? Because I think I missed it the first time around.
So even though we are increasing the number of contracts we have with staffing agencies, our goal is to not have to call them at all. And so since this is an contracted as needed, we are not under any obligation to contract with them. And therefore, when we have our own internal staffing levels up to the point where we want, we can discontinue these contracts or just not call upon them, or just use them as in an emergency situation. So, you know, if we get a flu outbreak and we have all the nurses call off on a 4th of July weekend, we would have some options.
And those staffing efforts are alongside these agreements, but not integrally part of them.
Correct.
Thank you.
Any other questions? Member Metzger.
I didn't see in the others, in this one in particular, it talked about an automatic renewal. Is there automatic renewal on the other ones also? I didn't see. That's why I looked for that and I could not locate that there's an automatic renewal after 1 year.
I would have to review the contracts. I do not have that notated in my drafts of these, so I don't know off the top of my head, Member Metzger. I would have to look.
Okay, but if we renew, it just means that we have the ability to utilize them. We are not, we don't have upfront monies and those kinds of things.
Correct.
Any other questions? Okay, all in favor of E1C? Raise your hand, please. Any opposed? Okay, that one passes. The next one is request approval of staffing agreement with All American Healthcare, and that was another one that you received today in email. Can I have a motion for that, please? Motion by Gordon, second by Robustelli. Any questions about this one? We probably covered most of the questions that all these, cover. I have a question just in general. So in the past, we've only had one agency that we've ever contracted with before, and this is a different direction to have these three different ones. And is the other contract still valid?
Yes, the other contract is still valid, and I believe we actually have two staffing agencies that we use right now, but only one that we utilize with any regularity.
Thank you. Other questions? If not, all in favor? Any opposed? Okay, motion passes. Ms. Metzger, could you please mute your microphone? Thank you. You have your general report. Would you like to highlight anything on that before we ask questions, or?
Yes, I made a correction on page 27 of your packets. Starts the financial report. And in response to a comment that Member Metzger made at the finance meeting, at the bottom of page 28, you will see the expenses and the revenue lines. For April of 2020, I corrected the revenue line and then have the May revenue line, and both of those should match the reports that you have from the treasurer. I was taking the cash that we received in those months as opposed to the revenue that we received in those months. And so those have been corrected, and so that should be an easier way for you to review both of those reports.
Thank you. Any other questions about this? Member Chung?
Thank you. I was just, I guess I'm a little concerned about the census because this is probably the lowest I've seen the census since I've been serving on the health committee. Is it, I'm assuming it's due to COVID and the pandemic. Do you know if other area nursing homes are having this sort of problem as well? Like, are just people not going into nursing homes right now? Are they deciding just to stay at home? Would you have any idea about this? Thank you.
I can answer that one. Yes, it is the same in the area. People are just staying home. They're afraid, so they're just staying home. And a lot of even the rehab facilities are not getting the census that they normally get with PT and OT. So yes, it's all over. But I am working with my admission team to come up with some strategies to hopefully now that things are starting to open up slowly, but to work out some strategies to get out there and market a little bit more. That answer your question?
Other questions? Member Gordon?
Thank you, Madam Chairman. This isn't a question. I'm just noting, and it is in connection with what Ms. Eden just noted in response to Member Chung. If you look, and I didn't do the detailed arithmetic, but if you start with January 2020 and go through May, the revenues at the county nursing home exceed expenditures by about $62,000 net. And but from both the question and answer that preceded my comment, I am guessing that and looking at the numbers going back further, going back into 2019, what has changed is the expenditures. The people aren't coming into the nursing home. There aren't new admits, and the expenditures are not increasing. The revenues, I guess, based on the people who are still in the nursing homes, not leaving, not in the nursing home and not leaving. But it just struck me that for all the wrong reasons, it's a welcome change. The expenditures are not well ahead of revenues, and in fact, slightly the other way around. Thank you.
Member Metzger?
I noted that also, and I was just wondering if it isn't the attention that we have been putting on the nursing home and making sure, I know that there's been a lot of work on accounts receivable. There's been a lot of work being done. So even though the census is significantly lower, we're at least not seeing the drain that we had been seeing, and I think that's a positive. And we appreciate the acknowledgement of working from a marketing perspective to get out there and try to encourage people to select the county nursing home.
I'd like to make a comment that I was very pleased to see that when we had our staff and our residents tested, there was no positives on COVID. And so I'm glad to see that our staff is making sure that our employees and our agency staff that we might be using are following proper protocol and trying to keep that population as safe as possible. So I was very pleased to see that and hope that it continues that way. Anyone else? Member Metzger.
And I think we need to acknowledge they had a recent audit that was very positive, and that I think we need to really acknowledge the efforts that were made to not have any tags. So thank you please thank the staff for that, please.
I will.
Anyone else? Oh, Member Chung.
Thank you. I guess I just wanted to also follow up on the testing at the nursing home. I'm just curious how the residents are being tested. So I'm assuming they're not going out to the site. Is somebody coming there? Is it for, I guess it's just how is it working? Is it also through the same lab that is handling the community-based testing site?
Through
Thank you.
Yeah, they are coming to the nursing home to be tested, and they are tested through Quest, which is through our medical directors.
A follow-up question though, and that's because I'm reading on the report, it says that the nursing home staff is going to the community-based site then?
Yes,
And then so that is the one that's being done then by, that everybody else is doing with Redidus, I think. And then so Quest is doing the residents at the nursing home, just to clarify?
correct.
Great, thank you so much.
Yes.
Okay, anyone else? Okay, thank you very much. Next, we have Shelley Welch and Jason Tabb, and we've already been told that Shelley is, I believe, on vacation. And so we have Jason. They have the report for both the adult and juvenile detention center. Are there any comments? Or Jason, do you have anything you would like to highlight or make a comment about?
No, I don't have anything to highlight, but I'd be happy to try to answer any questions.
Any questions for Mr. Tabb? I have one. On the contractual therapists, those hours jumped quite a bit in May. And is that because the March and April, they were pretty much not doing much of anything and then coming in and catching up for in May?
Yeah, we were shut down for quite a while. We were doing phone consultations with the therapist. She's been allowed to come in now and do non-contact visiting. So the hours and the number of contacts has gone up considerably, yes.
Okay, just wanted to clarify that that was the reason. Anyone else? Okay, hearing no other items, and we move on to the county administrator, Ms. Rodriguez.
Thank you, Chairman Schaefer. I really only have on tab item D1A, which is the county administration's report on recent employment activities, page 38 of your packet. And I can answer questions should the membership have questions.
Any questions for the administrator? Okay. Other business or communication? Anybody have anything? As Ms. McKnight mentioned, the Board of Health meeting is Wednesday. Instead of being after exec, it's actually before exec this month. So just want to let you all know that you can tune into that one. Anybody else? Member Metzger?
Time?
5:30. And I think we might be meeting.
For the exec?
No. Usually the Board of Health meeting is the week of our executive committee meeting. And it's always like the next day. But this time, the way it falls, it's actually before. So it's kind of close to this meeting.
Okay.
But it's at 5:30. And I believe it might be in person. Any other business or communication? If not, we have bills to pay.
Hey, Susan.
Yep.
Susan, I just appreciate your efforts with always looking for feedback for the Board of Health, and I think I would just reiterate to you what I said to Jessica, which I really do think people are craving clear direction on best practices, public health guidance for how to behave, and so if we can give that clarity and target vulnerable groups or groups that are higher risk, I think we will give ourselves a better chance at success in terms of the reopening efforts. I can say, for example, that lagging test results, that time frame, I don't think most people understand that. And so I think if we're going to be pushing stuff on social and in other places, we should let them know that just because 7 were positive today, that doesn't mean that they came, that happened yesterday even. That could have been a week ago. And so I I just think people need to be informed more around risk associated with their behavior and associated with uptick, so that when we start to see, or we are seeing now, an increase in cases, it's not too late for people to take their own action, which they should be doing anyway. But I just think the more information we can share, the better. So that is just going to be, there's contextual information that I think we really need to push more of. And the Board of Health is the agency that has to do it. It can't be anybody else at this point because it's not coming from other places.
Thank you. I will relay that information tomorrow, Wednesday, whenever. Don't know what day it is. Hearing on no other business or communication, our next meeting is Monday, August 3rd. We have bills to pay. I've received information from the auditor that she's reviewed them and they comply with all of our policies, ordinances, resolutions. And so the first is the nursing home has a prepaid total of $207,632.84. Their motion? Motion by Chung, second by Robustelli. All in favor? Any opposed? All right, that one passes. Next is jail and JDC Medical have a prepaid total of $102,305.25. Motion by Robustelli, second by Gordon. All in favor? Any opposed? Okay, that one passes. The Developmental Disabilities Board has a prepaid total of $58,160.12. Motion by Metzger, second by Chung. All in favor? Any opposed? Okay, and that passes. And then the Board of Health has a prepaid total of $177,831.31. Motion by Gordon, second by Chung. All in favor? Any opposed? Okay, that one passes. And so at that point, I believe that this meeting is adjourned. Thank you all.